Hello everyone. In this video I want to talk about developmental disabilities and how they happen. There are genetic disorders that can cause developmental disabilities, there's birth complications, and other things that can impact a pregnancy that can also cause developmental disabilities as well. One of the most common ones, one of the most common genetic disorders that we're familiar with is Down syndrome. And what that means when we say it's a genetic disorder, it means that there's an abnormality within that child's chromosomes. And that genetic disorders account for about 50% of developmental delays. And I'm just going to talk about two different ones, but there's many other ones where we can actually look at the chromosomes of that child and see where there might be a missing part of a chromosome or an additional part of the chromosome, something that is unusual about their chromosomal makeup that causes them to actually have this particular disorder. So kids with Down syndrome have an extra 21st chromosome, and this is what their chromosome panel would look like. And here on chromosome 21, they actually have 3 copies instead of 2 copies. And we don't know exactly why or how this actually happens. But we do know that it causes complications with intellectual abilities, physical abilities, cognitive abilities, maybe a little bit of social abilities, but not as much. But I think that extra chromosome interferes with the child's ability to function. And kids with Down syndrome can really have a bright future today. Many of them, I used to work with a whole classroom full of Down syndrome kids, and they're funny and they're cheerful and easygoing. That's why I say socially they seem to do very well. But intellectually and sometimes physically they'll have some delays. But many kids with Down syndrome can actually be average intelligence as well. So, they can have a case of Down syndrome that's very severe, or it can also be really mild as well. So it varies from child to child for sure, but it's one of the most common genetic disorders. Turner syndrome is less common. It also causes intellectual disabilities, and it's a missing or incomplete sex chromosome. So when you have the X and Y chromosome, one of these may be incomplete, not have enough information. And if you look at this little girl, she's kind of odd in shape. Her shoulders are a little broad. You can't really see her. She's got kind of a webbed neck. She's a little stocky for a girl. So there's, different things, and it's definitely something that we could see in the chromosome, and definitely is considered a genetic disorder. And this does not have anything to do with like transgender or anything like that. It's just that their physical characteristics are different because it affects that sex chromosome there. Developmental disabilities can also be caused by what we call teratogens, which are actually substances that can cause damage during pregnancy, and it causes damage to the fetus. So we know, that drugs and alcohol and nicotine, even caffeine, are things that can affect a fetus. And it makes sense to us that drugs and alcohol would affect a fetus. The other things maybe not so much. And think about how many children are exposed to drugs and alcohol, and I think we're not even really sure of all the effects of drugs and alcohol on a growing fetus. But many moms don't recognize that they're pregnant right away, and those early stages of pregnancy are really important to physical development, brain development, all sorts of infant development. So that can be one of the major problems. So we know drugs and alcohol are bad, and that you should definitely not use drugs or alcohol during pregnancy. But things like nicotine, smoking cigarettes, you wouldn't think would be terrible, but it actually does affect the infant's heart rate, often affects their size, and it really can be problematic. The same thing with caffeine as well. So we want to avoid those things during pregnancy. They're not as damaging as some of the others. But little things like a flu, and sometimes taking aspirin is not a good thing. So it's really important to protect that pregnancy and to follow your doctor's instructions and be really careful about that. Fetal alcohol syndrome is something that used to be much more common because people didn't realize that alcohol was bad for a growing fetus. It seems kind of obvious to us now, but they didn't recognize it. So this little girl here has fetal alcohol syndrome, and you can tell that she looks a little bit different. Her eyes are a little bit wide set. I don't know what else. Her head is long and narrow, and her ears are kind of set low. And those are signs of fetal alcohol syndrome. And kids with fetal alcohol syndrome often have intellectual disabilities, social disabilities, many different disabilities. This is an example of a brain with a child that had fetal alcohol syndrome. And this is kind of what a normal brain should look like. So definitely impacts the brain development of a young child. And it depends on how much alcohol that mom is drinking. This isn't just one or two drinks during pregnancy. This is daily drinking, many, many drinks a day that would cause really severe damage. But, you know, none of it is necessarily good for a fetus. But we're talking heavy alcohol use, not just a drink here and there. Other things can cause developmental disabilities. Cerebral palsy is probably a term that you have heard. And really, cerebral palsy is a lack of oxygen when the child is being born, and it can be caused by many things. Cerebral palsy is a little bit of a catch-all term when they don't know what caused the child to have particular deficits, but definitely if there are complications during birth where the child is deprived of oxygen, that can cause part of the brain to actually die and then cause that child to have developmental disabilities. Sometimes with people with cerebral palsies, it's just a physical disability. They might walk with a limp or have difficulty using one arm, but cognitively, intellectually, they're perfectly fine. So there's a wide range of disabilities that go along with cerebral palsy as well. Um, you know, um, Sometimes when we think it's kind of exciting to have triplets or quadruplets or quintuplets, but often those babies are compromised because in order to birth 5 babies, even if you're doing it as a C-section, it can be really complicated ensuring that each of those babies has enough nutrition, has enough room in the womb to grow, and then also at birth has enough oxygen and they can deliver them safely. So oftentimes when there's multiple babies, there is much higher risk for developmental disabilities. Premature babies, preemies, definitely can have developmental delays. Now, oftentimes, I usually have several people in class that were preemies, and sometimes it's just a matter of you're a month or so behind your peers until you can catch up. So, a baby who is born a month early is going to be a month behind their peers because they need to make up for that time that they didn't have in the womb. And oftentimes, people that are preemies can, you know, grow into it and be very normal, but other times they can have deficits as well. So it can cause delays in physical development, cognitive development, and psychosocial development. Oops, that's prematurity. Other things that can cause developmental delays that people might not think about are brain injuries. So, a head injury from a fall, near drownings. We see a lot of sad cases on television where a child has been rescued from the pool and we think, oh, I'm so glad that they survived. But many of these kids really survive with pretty severe deficits and brain injuries. Um, you know, and then I wanted to talk a little bit about autism. It's not in the book. I'm going to talk about autism and ADD really quickly, just because it's something I think that's really common that people wonder about. So The Good Doctor is a show on television about a guy with high functioning autism, super intelligent guy, but definitely lacking in some social skills. So autism, and now they call it autism spectrum disorder. And you'd think that it's just sort of skyrocketing the amount of cases of autism that we have today, but actually autism is really not increasing, even though it seems like it is. It's because they've widened that diagnosis or that definition of autism. We used to only diagnose kids with really severe forms of autism, and today we diagnose those kids with even really mild forms of autism. And the reason we do that is because we can actually really help kids with milder autism. We can help kids with autism as in more severe forms as well, but we can definitely have a huge impact on kids with mild autism. There's no gene that's been identified that causes autism, and they certainly have researched that. There is some research out there saying that older fathers could also contribute to the increase in autism. And 1.5% of children are diagnosed with an autism spectrum disorder. And the reason why we call it autism spectrum is that there's a huge range. There are some kids that have a really mild uh, case of autism, and then we have kids with a really severe case. And some of the kids with a severe case of autism have intellectual disabilities, physical disabilities, and many other disabilities as well. So Asperger's is a term that you may have heard of, and the Good Doctor might be a good example of somebody with Asperger's. And this is where somebody has really high intelligence and yet they suffer from autism. So it's autism with higher cognitive functioning. And you still hear this term used a lot, but today we would not use that term. We would just say the person is a high functioning, mild case of autism spectrum disorder. So lots of good treatments are available, especially behavioral treatments for autism, and that are really effective. They use behavioral interventions, and they also use a lot of teaching, recognizing emotions, expressing emotions, understanding emotions, and children can really do very well with autism today. So that's why we're diagnosing them more. So kids with autism have trouble understanding social cues, reading nonverbal cues. They have trouble regulating their emotions. So you see them, they might throw a fit or act really, have a really extreme reaction to different situations, and it seems like it shouldn't be that extreme. They're unable to see things from another person's perspective. They also often have sensory issues where they're really hypersensitive to certain things. They don't like bright lights. They might not like certain textures. Certain sounds may really irritate them. A lot of kids with autism will, they want to wear that same soft shirt all the time, and they refuse to wear anything else. And one of the things that treatment for autism does is really help the parents to understand when it's worth it to fight battles and when it's worth it to just let them wear that same ratty t-shirt that they love. um, and how to help them not get into a fit over something, how to help prepare them for situations. A lot of times kids with autism have difficulty going from one activity to another. They often like their routine, they need that routine, and if you can provide that for them, it creates a lot less trouble. So a lot of kids with autism will have really repetitive behaviors. They have a restricted range of activities, which means they only like to do a few things. They might play with Legos and they just sort of obsessively play with that one thing. They also might repeat certain sounds or phrases. They like to rock. They may obsessively talk about things. They like to order things and fidget. Um, and often they get sort of obsessed with dinosaurs or something that they're interested in. And they're very rigid in their routine. And if you have to change that routine, they often flip out. And so you have to be really cautious with that. And parents need to understand that the kids need that routine. And you know, if you have to interrupt it, you have to interrupt it, but you don't want to do it very often. And they have what we call ritualized behavior. So they do the same thing kind of over and over again sometimes. And I mentioned this before, that sometimes kids have very mild cases of autism and some have very severe cases of autism. And so it can be kind of confusing because, one person is diagnosed with autism and they seem pretty normal to you. And then somebody else is diagnosed with that same diagnosis and they have really severe disabilities. So that's why we call it a spectrum disorder. Attention deficit disorder, they used to call it ADHD, and now we actually call it ADD. I need to change the slide. Attention deficit disorder. The H stands for hyperactivity, and some kids have hyperactivity with attention deficit, but not every child does. So the new diagnosis is attention deficit disorder with or without hyperactivity. And girls often have attention deficit disorder where they have difficulty focusing, and they're disorganized, they lose stuff and they get really easily distracted, but they tend to be quiet about it, whereas boys tend to have that hyperactivity part of it and often get themselves in trouble and often get themselves noticed. So one of the things is not every child with attention deficit has um, hyperactivity. So 5% of kids have been diagnosed with attention deficit and 2.5% of adults. So we used to think that kids grew out of attention deficit as adults, and today we kind of know that that's not true. Many people continue with many of these symptoms into adulthood. So it's not something that a child will necessarily grow out of. And sometimes as adults, they may have other disorders, sometimes bipolar disorder. Oppositional defiant disorder is a childhood disorder. It's kind of a behavioral disorder problem that can lead to conduct disorder, which often leads to criminal behavior as well. So, we definitely want to pay attention to these kids and help these kids as best that we can. So the medication is the primary treatment for attention deficit disorder, but there's definitely parenting skills and helping parents to, kids with attention deficit also need routine, and also, need help and understanding that they're not doing some of these things intentionally, that it's part of their disorder. So there's many different medications that are stimulant medications, and there's controversy about giving these heavier medications to kids, but they do seem to help children with attention deficit disorder. It's one of the ways we can actually confirm a diagnosis of attention deficit disorder. If you gave a normal child a stimulant medication, it would make them hyper and kind of crazy. And if you give a child with attention deficit disorder a stimulant, it actually calms them down and makes it possible for them to really focus and slow their thinking down enough. We think that the stimulant is actually activating that frontal part of the brain that may be underactive in kids with attention deficit, and that's why it works. Caffeine used to be an old-fashioned treatment for people with attention deficit disorder, and it does have a stimulant effect. It does help kids with focus, and it's supposed to be non-addictive in children and adults with attention deficit disorder. If you and I took stimulant medication, we would probably become addicted to it, and we'd also be pretty hyper as well. There are new medications, or they're trying to find new medications that are not a stimulant, but so far I don't know that there's been a lot of success with that. But definitely behavior therapy, parenting skills, family therapy are often really effective to help families. Sometimes parents get really frustrated with kids with attention deficit disorder, and they can sort of make the situation worse by not really understanding where they're at. I wanted to mention a little bit, and I think in chapter 6 they talked about this developmental disability certificate at Glendale Community here. If you are interested in working with children or with adults with developmental disabilities, this is a great program. It's 16 credit hours, so it's really 5 classes, and one of those classes is this class that you're taking. So it's 4 classes beyond this plus an internship, and 2 of the classes are understanding and changing behavior, the psychology of developmental disabilities, and maybe developmental psych. And once you get this, you will have a certification that says that you're capable and trained in helping kids with developmental disabilities, and they can actually help you get a job that you could do through college. And it's also a great thing to have if you want to work with children, either psychology-wise or maybe in nursing or in any other field, or teaching as well. So I just want to make sure you guys knew that was available here at GCC. Thanks for listening.